The people, the headlines, the issues impacting you and your family. This week in Cincinnati on 9 on Your Side.
Good morning and welcome to This Week in Cincinnati. I'm Kristen Hartman. First today, Ohio Governor John Kasich. I sat down with him this week for an extensive interview. We covered issues from the state's future to his future to President Trump. But first, Ohio's new plan to fight the drug crisis. The governor is rolling out a new plan where Ohio Pharmacy Board will more closely monitor the more than 500 wholesalers that supply neighborhood pharmacies. That plan was presented at a news conference Thursday. The goal is to find out where unusual amounts of drugs are being distributed. Why are you so passionate about this?
Well, because, this is death, circulating around, avoidable death. And it's been a long road. The thing that frustrates me is we're beginning to see some progress, and I think people need to know, because the headlines are always, where it's out of control, it's terrible, and it is terrible. But it's not like we're not starting to see the clearing out here, that these things are beginning to work for us. That does not mean that by any stretch of the imagination we're going to let up or relax, but sometimes people need to hear a little bit of good news.
Okay, by going after the wholesalers and by keeping an eye on pharmacies and doctors and how they prescribe and all of that, is the idea that we're able to cut off addiction at the pass?
Yeah, that's exactly, started early. A lot of people through the years, I don't know how many, but there were people who would go to the dentist or go to the doctor and they'd go home with 40 of these pills and they just took them because they weren't worried about them. The next thing you know, they were addicted. And then over time, as these pills became harder and harder to get, either they overdosed or they went to some other drug.
Yeah.
So by getting to at the beginning of this, and look, I'm not going after, the idea is not going after, it's to just make sure that those who are not responsible are held accountable. And but what's so amazing about this, every time you look, it morphs in another way because there's people making a lot of money in the business of killing our citizens.
So what I'm gathering is the idea here is control what you can control through the proper means, through the state means.
That's the opiate thing is through that.
Control what you can control and then bring the community in where you can. That was the whole community piece
I agree
of what
with
you were
that. I
saying.
mean, it's sort of like if somebody loses their job, okay, what do we do? What do we do to help them? I mean, where are we? Where are we with our neighbor? Am I my brother's keeper? We absolutely are. See, but we're all so much of the time waiting for somebody else. We've grown accustomed to somebody else will help fix it, and it's not my problem. Remember years ago when I was a kid, and not even that many years ago, or even back in the days of the Great Depression, people helped one another. And we're seeing a lot of it, particularly among our young people. They have a heart for helping.
Yeah.
We got to surround the injured, and we've got to help them.
As a governor, what leverage do you have to control that so people aren't paying? Just the other day I spoke with somebody who can't afford to take his MS medication.
Yeah, I mean, it breaks your heart. I'm doing everything I can to try to negotiate these prices down in Medicaid, hoping the private sector will follow. If we were to think just down there in Cincinnati and you were to think about GE, for example, and GE's very progressive on these things, GE can have the power because of the number of people that they insure to begin to demand certain things for the providers, including pharmaceuticals. And we just all have to be in this. Now, we don't want to destroy the pharmaceutical industry because, look at what they're doing on hepatitis now. Incredible breakthroughs. At the same time, there's got to be a reasonableness to all this. And I think the president said in the State of the Union address, because I talked to him about this last January, that this is a major problem because when you look at healthcare costs, pharmaceuticals are the biggest part of the rise in terms of healthcare. And they have to be in the circle of delivering quality at lower prices.
How do you wrangle that?
Well, it gets to be through the market with a company like GE, through us in Medicaid. I want the power to exclude high-priced drugs that there's no purpose for them. I want to be able to say, sorry, if you're not going to negotiate with me, we're not providing it. And we need enhanced power to do that. I hope we'll get it.
Okay. You hope the feds will give that to you?
Yeah, I hope they'll move together to say, yes, you can do this.
Okay. And if you were to have a conversation with President Trump in the near future, is that something that you would talk about?
Oh, I got a whole long, arm list of things to talk about. It would certainly be one of them.
Okay. What would also be on that list?
I don't want to get into conversations with Trump. I have, trade,
Sure.
debt. I mean, there's a lot of different things.
Okay.
Reforming healthcare in a responsible way, not shipping all the immigrants out of this country, taking care of DACA. These are the things. These are things at the heart. I think sometimes in politics, people get focused on like policy, elections, statistics, and all that. We're dealing with human beings who hurt, the fact that we can have young people who came into this country, kids, who have been a part of the fabric of our country, these dreamers, DACA kids, and that somehow we could engage in a program to ship them out, it's like nuts to me. And I think people need to fight for them. I bring all those things up.
I asked Governor Kasich if he were to run for president again, would he do so as an independent candidate? He said no. His words, quote, "I'm a Republican, and that's not even practical."